Hello. In this video, I will be introducing the Health and Wellness exhibit located in the Chaska Historical Society. It is an amazing exhibit with many interesting artifacts and pieces of history. If you cannot come in person, however, I have created several videos that highlight the different parts of the exhibit, from unsafe business practices to several invaluable health practitioners that have helped Chaska over time. Within this introductory video, I will be highlighting some of the interactive pieces, the fun fact spinner wall, and the use of the mask. I hope these videos will help display the fascinating aspects of history that I and so many others appreciate. Enjoy. The Big Spinner. When walking into the building, you'll find a huge spinner wall with all sorts of information. You pick up a random card that will say what gender and age you are, and the time period that you live in. Then you spin the wheel and see what disease you catch. Each disease has a description based off of the time period in which it was prominent and the most vulnerable of groups. For instance, let's say that I was a 7-year-old male in 1982 and I caught measles. I wouldn't be in as much of a danger as if I had lived before 1963, as that was when the measles vaccine was created. Another interactive piece is the token decider. This piece shows what kind of treatment you would get if you had a headache during a certain period in time. For instance, within the years 1862 to 1885, you may have had to apply an ice and salt mixture to spots on the head, whereas in the year 1900, you would take aspirin. Even in the past, it was known that a mask would help not getting sick. Here are some illustrations showcasing similar ideas. Now, for some fun facts. Feel free to pause the video at any time. You live far from town and neighbors. It is 1878 and your baby has croup. What do you do? Many folks would turn to their cookbooks. From the mid 19th century to the early 20th century, most cookbooks had sections for caring for the sick. The Buckeye Cookery and Practical Housekeeping has a sure cure for croup. Boil pig's feet in water without salt, and let it stand overnight. In the morning, skim off the fat. Put in a tin pan, boil until all water is evaporated, bottle, and keep for use. Give a teaspoon every 15 minutes, and apply freely to the chest and throat. Mrs. Hill's new cookbook recommended a syrup of onions and brown sugar, as well as a chest plaster of Scotch snuff. What worldwide epidemic occurred in 1918? Here's a clue. It was a 1918 jump rope rhyme. I had a little bird. Its name was Enza. I opened the window, and influenza. The Spanish flu. The Spanish flu was a worldwide epidemic that is thought to have originated at Fort Riley in Kansas. The first recorded case was in March 11th, 1918. The reason why it was called the Spanish flu is because it rose to prominence in the last year of the First World War. Many countries involved had instituted press censorship, thus hiding the fact that many of their soldiers were dying from this deadly disease. However, Spain was not in the war, and so its press did not have the same constraints as other countries. Thus, it was widely known due to the Spanish press reporting on it. Sometimes called 3-day fever or purple death often ensued from secondary infection of pneumonia. The unusual aspect of the Spanish flu is that it affected young adults. The average age of death was 28 years old. It's 1897, and you have just enjoyed an afternoon of high entertainment with a Wild West show. Exotic costumes, dancing, acrobatics, and maybe even fancy shooting. Then you hear, "How much is your health worth, ladies and gentlemen? $1/2 is all it takes to put you in the pink. This remedy will succeed where other doctors have failed." Where are you? The Medicine Show. Miracle working medicines for all that ails you. You bought snake oil at the medicine show. Wait, was there really such a thing? Well, yeah. Do you know which popular soft drinks were once cures for what ails you? In the 19th century, Coca-Cola was advertised as a brain tonic, cure for nervous affectations, sick headaches, neuralgia, and melancholy. It was also touted as the intellectual beverage and temperance drink. Bib label lithiated lemon lime soda. It contained lithium citrate, which was a drug used to treat patients with mental health problems. And here is an aid in digestion and restore vim, vigor, and vitality. What on earth are dropsy, catarrh, and apoplexy? Catarrh was what we now call postnasal drip, and can include other symptoms such as a cough. This can often be a temporary head cold, but sometimes can last for months or even years. Dropsy was an old-fashioned term for generalized swelling. The modern term is heart failure, which causes edema or fluid retention, especially in the feet, legs, and ankles. Apoplexy refers to a sudden death, beginning with the loss of consciousness, shortly followed by death, often a stroke. Because of lack of medical knowledge up through the late 19th century, it could also cause heart attacks and aneurysms. It's the year 1883, your tooth has been painful for weeks, and your face looks swollen. Wait, why are you going to the general store? You live in a small town with no dentist, doctor, or pharmacy. Often in the 19th century, and even early 20th century, dentists, especially in rural areas, would travel from town to town making a circuit ride. They would rent rooms in a hotel or other building and be available to treat patients for a few days, a month. Sometimes waiting for the dentist could be excruciating. You go to the general store to buy some sort of pain relief. In the 19th and early 20th centuries, general stores not only carried most items a person living in a small town or rural area would need, barbed wire, cloth, canned goods, hats, and multiple other goods, but they also carried patented medicines. Most likely the pain reliever you would buy contained opium, laudanum, or cocaine. Here are some references that were used for images. Thank you for watching, and I hope you enjoy the videos.